Hey friends, Ashton here with SMNP Reviews. I'm a family and emergency nurse practitioner and an instructor with SMNP Reviews. In this video, we're going to be discussing a few basic hematology concepts, particularly anemias. For a deeper dive into this topic, definitely check out one of our review courses. Also be sure to click that subscribe button so you don't miss out on our latest videos. First, to be able to recognize any anemia, we have to be familiar with our basic lab values. So let's do a quick review. A normal hemoglobin level is approximately 12 to 18 grams per deciliter for women and 14 to 17 grams per deciliter for men. Remember that the hematocrit level is approximately 3 times the hemoglobin level, so about 36 to 47% for women and 41 to 51% for men. Next, let's take a look at some of our red cell indices, as these can provide helpful clues into exactly what type of anemia we're dealing with. The MCV, or mean corpuscular volume, tells us about the size of our red blood cells. A normal level is approximately 80 to 100 femtoliters and is often described as normocytic. When the MCV is low, the red cells are small, and we know we're dealing with a microcytic anemia. Conversely, when the MCV is high or the red cells are large, we know we're looking at a macrocytic anemia. The MCH, or mean corpuscular hemoglobin, tells us about the hemoglobin content, or the color of our red blood cells, and a normal value is around 28 to 32 picograms. So when the MCH is low, the cells are pale, and we refer to them as hypochromic. And when the MCH is normal, the cells are said to be normochromic. Extra exam tip here, always look at the MCV first. Remember, MCV holds the key. Iron deficiency anemia is one of the most common microcytic hypochromic anemias, meaning that the cells are small and pale. Risk factors include blood loss, reduced intake or absorption, even taking certain medications such as proton pump inhibitors or PPIs. Patients with iron deficiency anemia may present with fatigue, pallor, hair loss, headaches, exertional dyspnea, and exercise intolerance, cholonychia or spoon-shaped nails, and even pica, which is that craving for non-food items such as dirt, paper, or ice. Now let's review a practice question together. A 25-year-old patient with a past history of hypothyroidism and polycystic ovary syndrome, or PCOS, presents with reports of fatigue, brittle hair, and a recent craving for ice. The nurse practitioner orders a CBC and TSH. The patient results are as follows: hemoglobin 10 grams per deciliter, hematocrit 29.5%, MCV 65, MCH 20, TSH 1.9. What is the best next action by the nurse practitioner? Is it A, order a B12 and folate level, B, order a serum iron, ferritin, and total iron binding capacity, or TIBC, C, prescribe supplemental oral iron, or D, refer the patient to hematology? Looking at these results, we know the hemoglobin and hematocrit are low. The TSH is within normal range, the MCV is less than 80, and the patient has been demonstrating signs of pica. So we should definitely be thinking about a microcytic anemia. Option A is macrocytic, so we can immediately rule that one out. Option D doesn't really sound necessary at this point, as this can likely be managed in primary care. So we're left with B and C. Even though we suspect this patient most likely has iron deficiency anemia, we don't know for certain that their iron stores are even low, so it's probably premature to prescribe supplemental iron just yet. Therefore, option B is the best choice. The nurse practitioner should order a serum iron, ferritin, and TIBC to confirm that diagnosis of iron deficiency anemia. There are several more anemia topics to cover for your exams, so be sure to check out our courses for a more in-depth review. I hope you found this video helpful in reviewing a few of the basics. Also, if you are looking for an amazing free community of students just like yourself prepping for their board exams, make sure to join our Facebook group, and these will be linked in the description. Here are my references. And that wraps up this video. Be sure to subscribe to our channel and check out our other videos. You are so close to becoming a real deal NP. We are rooting for you.